Good morning. Last year, I took a gamble. And I'm not a big gambler, but I enjoy the casinos every now and then. But last December, I actually gambled on something that I thought was a sure bet. My life, my health. And I won. I actually won. I beat the house. Now, I've done some research in the past couple of days since I've been back in Lancaster. And what I have found has astonished even myself. People asked me last December when I chose to become uninsured, one of the 40 million who are uninsured in this country. And I even said, it's not that I can't afford health insurance. I just don't want to pay for it because it's too expensive and gives me nothing. So I did some math. And just for me personally, I'm going to share my own personal story with you. And I don't want any of you to think that you can maybe be like me. You have to determine this for yourself. But you have to understand, as most of you know, that first and foremost, I am blessed for some reason, fate, God, whatever, with absolutely fairly decent health, even though I don't live a healthy lifestyle, at least according to health insurance companies, because they try to overcharge me because I smoke cigarettes, because I'm over 50. And I found that this was not acceptable to me. So let me first go through the math that I did because I'm not good at math, but it was actually very interesting because what I did this past week was I actually made some phone calls to places where perhaps I might want to get a checkup, my OBGYN and the place that does my mammograms. And what I found really did astonish me. So here's what I found. I'm going to have to wear my glasses, so if you see a reflection, I apologize, but it's the way it is. Okay, so when I called the imaging center in Lancaster, and I said, without any shame whatsoever, I have no health insurance, and I'm probably going to be due for a mammogram. If I come in there and I get my mammogram and I give you a credit card and I pay you, what will you charge me? And the answer was $233. Now, the last time I had a mammogram and I had health insurance, and it was through, the Affordable Care Act for Women was there, and I didn't pay anything. But do you know what this imaging center billed my insurance company? $630. Yeah, yeah. So there's one example. I called my OBGYN next. I'm probably due for a ladies exam, pap smear, pelvic exam, the whole 9 yards. I have no health insurance. I'm going to pay you at the time of the service. What will it cost me? Well, $192.64. Now, if I had insurance, they would bill the insurance company $344. And the woman actually at the OBGYN was very forthcoming. She said, you're getting a discount for paying for self-paying. You will get a discount. And she said, by the way, the lab that reads the pap smear, they're going to send you a bill. Well, when you get that bill, call that lab, call the number, tell them you're self-pay. You're going to pay right then and there, and they're going to give you a discount too. Almost all medical providers will give you a discount if you self-pay. So why do we need health insurance again? All right, let's get to some more numbers. So, okay, last December, we were told that I would have to pay for me individually, because we are self-employed. They were going to charge me for premiums $750 per month. So that's times 12, which equals $9,000 per year. The deductible for anything other than preventative care was $7,500 per year. So that equals $16,500. So when I sat down at this poker table last January, when I became uninsured, I had $16,500 in chips sitting in front of me. Okay, this is going to be fun. It's going to be a fun show. So now, okay, well, the government says you have to buy health insurance. You're going to get penalized. Well, yeah, you know what? The most I can be penalized for refusing to pay for health insurance that is designed for me never to use it is $600. So, okay, I just gambled and lost $600. So now I am down to $15,900 in poker chips. I'm still doing pretty good, aren't I? Yeah, I'm still winning. Okay, I decide I'm going to have a mammogram this year. So I'm going to go in, I'm going to get my mammogram, I'm going to pay $233. So I just threw $233 in chips out there. I'm now at $15,667. And I'm still ahead. Still winning. And oh yeah, let me throw in a pap smear and pelvic exam too. That's $192. And now I am at $15,475 in chips. It's almost December, folks. Barring any unforeseen, ridiculous circumstances, I cash that in and I'm really ahead. How many of you have ever gone to a casino and won $15,475? I just did. Now, I know what some of you are going to say, well, what if you had had a catastrophic illness? Well, now that's where the deductible comes in. Because you have to remember, I am paying $9,000 a year for the health insurance premium. But if I would have gotten sick under that health insurance company, every dollar I spent up to $7,500, I would have had to pay out of pocket anyway. Anyway. I think I still win. Now, I was blessed. I am very blessed. I had no accidents. I had no injuries. I did have health issues this year. Quite a few of them, actually. Some of these health issues that I had, some of you may have run to urgent care for, or run to the doctor for, or run to the emergency room for. See, I don't roll that way. Okay? I had bronchitis in May. And yes, I could have run to the doctor and gotten antibiotics, but I didn't. I used over-the-counter cough syrup, Vicks VapoRub, Coldies, all kinds of medications that were over-the-counter at the pharmacy. And yes, I was not very happy for 2 weeks. Actually, 3 weeks. I was still coughing, bringing up green stuff. But again, I healed. I was fine. And it did not cost me a doctor visit. It didn't cost me a trip to the doctor or sitting in a waiting room. I got over it. I had this thing on my foot that you all saw pictures of if you were watching me over the summer. It's called a bunionette. Again, thank God for Google. Because I looked for everything and could not find what my toe looked like. But I found it, finally. It's a bunionette. And I have a friend who uses syringes for insulin. And she gave me a clean syringe, and I excised my bunionette, and I soaked it, and I wrapped it up real tight, and it went away. Imagine that. Guess how much that one cost me? Nothing. And the funny thing is, probably if I had gone to some kind of doctor or something, they would have wanted to do surgery or all kinds of weird shit. They probably would have charged me $2,000. I did it at home, all by myself. Yeah, it was painful, but it went away. It's all good. I went out to eat last Thursday, and I wore some really high heels, and I ended up spraining my ankle really, really bad. I mean bad. To where it hurt. I mean, hurt. To the point where I could not walk. But luckily, I had purchased years ago a little wrap thing for your ankle from CVS for maybe 15 bucks. So I wrapped my ankle real nice and tight, and it was very painful. But lo and behold, my husband was even like, should I take you to urgent care? Maybe it's a fracture. I said, well, first of all, it's not broken. It's not swollen. It's just a really bad sprain. It could be a stress fracture, which basically heals itself anyway. And anything that urgent care would do, other than an x-ray, which is going to cost me hundreds of dollars, is they're going to wrap it or put me in a boot for 6 weeks, which I'm not doing anyway. Not wearing a boot. So I wrapped it. I wore the wrap. Guess what? It was painful on Thursday. It was really painful on Friday. It was excruciating on Saturday and on Sunday and on Monday. But I woke up on Tuesday and all of a sudden it felt really good. It felt better. I took the wrap off and now I can walk and I'm fine without a medical bill. There are so many things that we run to ER for, that we run to the doctor for, that we run to urgent care for, that we really don't need them for. Trust me. I have a cyst on my neck back here. I've had it for, 12 years. Every now and then my husband pokes it with a needle, drains it. It goes away, it comes back. It's not deadly, obviously, or I'd be dead by now. Some people, when they saw that, would run to a doctor. No, that's not how I roll. I have cut myself with knives, because I am a chef, to the point where my own husband says, you need stitches. I'm like, the hell I do. What I need is some masking tape. And I just cut the masking tape in strips and butterfly it shut, hold it up in the air for a couple hours, and it's fine. It's fine. I don't race to the doctor and race to the emergency room for every little thing, because I have found in my own personal life, and again, this is just me, I'm not a doctor, but I have found that 95% of anything that is wrong with you can be treated right in your own home with things you have laying around the house. You know, have some acid reflux? You don't need Prilosec. Well, Prilosec is over the counter, so that works. You don't need that prescription. Just drink a little bit of apple cider vinegar. Perfect. In fact, apple cider vinegar works for a lot of things. It actually worked for the bunionette. You soak the bunionette in some Dawn dishwashing liquid and apple cider vinegar, and it gets nice and soft, and you poke it with a needle, you drain it, and it's done. And it costs you nothing. Unless you don't have apple cider vinegar in your house, then you got to go buy it. Or you have a dishwasher and you use Dawn. You got to buy the Dawn. Again, $8. Go to the doctor for a bunionette and see what you pay. You don't need to go to the doctor for every little thing, even bronchitis. If you are healthy, like I was when I got bronchitis, it can go away by itself. It's annoying. It's uncomfortable. It's miserable. But you don't need to be taking the prescription drugs. You don't need to be paying the farm companies for their poisons. Just got to be a strong girl like I am and get through it. And nobody is more miserable than Paula Luciano when I'm sick. That's why now I have a case of Cody's everywhere, including at the Bay. Cody's works, by the way. Okay, let's continue back on this health insurance thing. Okay, some of you, you've heard my math. You have seen that right now, the gamble I took last December has paid off for me huge. Okay? Now, there was an article, actually a segment on WGAL here in Lancaster about a couple. And they also were like my husband and I. They were being way overcharged by Blue Cross Blue Shield for their health care. And so they were not paying it. And what they have started doing now is they put what they would have paid in premiums into a health savings account, which you can do. And they also have found something called Transparency Healthcare. And they interviewed a doctor who said this: We are not in the practice of not wanting to treat people simply because they don't have health insurance. We are willing to negotiate with them. And that's what this couple has done. She needed an ultrasound or something, and it was $500. They said $500. I said, sure, I'll pay that. I'll pay $500. It's cheaper than the $2,500 per month Blue Cross Blue Shield was going to charge me. Plus the deductible, because it was an ill visit. You can negotiate. And here is what I think is very important. Everybody says it is the cost of medical care in this country because it's so good that is driving up all these premiums and all these prices. That's not the truth. That's not the truth. Listen to what I said. If you have health insurance, your health insurance will be billed double what a mammogram is actually worth. Why? Why? Well, you gotta pay for the paperwork. The imaging center has to hire a billing person to deal with the insurance company. The insurance company has to do paperwork back and forth and cut checks and negotiate, and then they negotiate down. When I had my $630 mammogram, when I got the explanation of benefits, the insurance company did not pay $630. They paid something like $300. But I'm going to pay $233 because they don't have to deal with the insurance company. $233 is what that mammogram is actually worth. Same thing with the pap smear and pelvic exam. It is worth $192. It is not worth $344. But that's what an insurance company will be billed. Now, I don't know who you want to blame for this, but the bottom line is when you cut out the insurance company, all of a sudden, the cost of care comes down. Procedures come down. Office visits come down. Preventative screenings come down. Even surgeries come down when you're paying out of your pocket. There is no shame, my friends, in making a phone call and saying, I don't have health insurance. I need this procedure. What will you charge me for it? When I come in there, I get the procedure and I'm going to pay you right then and there. It doesn't hurt to ask, and it's not painful at all. It's a lot less painful than actually going for a preventative test and then sitting around waiting for the phone to ring to make sure you're healthy. Don't be ashamed to ask questions. We did this on the show, the first show of this season, on Wednesday. Ask questions. Use your brain. Use your mouth. Ask the question, because doctors, there are still many doctors in this country who actually are in it to help you, to cure people, to make people better, to make people good who are sick, well who are sick. They don't want to turn you away. They want to earn a living. But I promise you, if you negotiate a price as an uninsured person, they're not going to take your house. They're not going to triple charge you because you don't have insurance. They're not going to punish you. If anything, you're getting rewarded for not having health insurance. As I said, when my pap smear is read by the lab, the girl at the OBGYN said, you call that lab and you say you're self-pay. You'll get a discount for that too, because you're self-pay. It's something to think about. Now look, there are programs. This couple from Lancaster on the WGAL site, they have AFLAC, which my husband and I are actually going to look into. And what they have with AFLAC is long-term hospital care is covered and cancer is covered. And they pay $238 a month for that. Now, I'm not sure if that's $238 per person or $238 for the couple. But it's a hell of a lot cheaper than the $2,500 a month Blue Cross Blue Shield was going to try to charge them, along with their deductible. Remember this, when you sit down to a poker table with a health insurance company, it's like sitting down at, well, the Taj Mahal when Trump owned it. The house always wins. The odds are stacked against you because the health insurance company comes to that table with more chips than you could ever imagine. And you're sitting there with your little stack of chips. And you won't win. You will never win when you're dealing with an insurance company. They always win. The house always wins. It's a rigged game. They sell you a product that is designed for you hardly ever to use, or to be difficult to use, or confusing to use. So for those in Congress right now who are saying, oh, we need healthcare reform, how about just get rid of the fucking health insurance companies and get back to letting doctors practice medicine and patients paying for what they actually need and want? Sounds simple to me. What do you guys think? Hey, love shows and grows, and I got a lot of love right now for the fact that I just banked $1,500. Wonder what I should do with it. You know what? I think I'm going to put it in a health savings account. Just in case. Political Paul is out.